Well, hello, everyone, and welcome to episode 10 of RTMatters, where candid conversations take place about what matters most to respiratory therapists. I'm Patrick Dunne, your host, and I'm delighted to welcome you into this special episode of RTMatters. Now, before we begin, a few housekeeping details to attend to, especially for our first-time listeners. First, all episodes, past and future, are all available at no charge, no subscription fee, no membership required. Second, we welcome your feedback. We want to hear from you. You're our listeners. Any thoughts you have about this or other episodes, let us know. Any requests for additional information about any episode, and most importantly, perhaps what really matters to you as a respiratory therapist. You can email us directly by hitting the link feedback@rtmatters.com, which is located in the introduction of every one of the episodes, or you can just email me feedback@rtmatters.com. RT Matters is the virtual voice of respiratory therapists everywhere, so please let us and let your fellow RTs know about this. Now on to this episode of RT Matters, Post-Acute Respiratory Care, a growing demand for respiratory therapists. Now, before I introduce our excellent speaker and our host for today, I'd like to set the stage for this particular episode. Overall, the disease burden of chronic conditions in the U.S. has been rising dramatically. For example, there was a study done in 2015 that had over 30 million people in the U.S. who had 3 or more chronic conditions, and that number is expected to increase to 83 million by the year 2030. And the term that is used to describe these patients is polychronic, 3 or more chronic conditions. Now, there are multiple factors driving this increase. First of all, the 2 major most important ones, longer lifespans and lifestyle choices. And they basically increase the chance of developing multiple chronic conditions. This trend not only contributes to poor health outcomes, but also places a huge financial strain on the healthcare system, where over 90% of the $5 trillion U.S. expenditures in healthcare goes to treat patients with 1 or more chronic conditions. Unfortunately, our traditional healthcare system has been slow to change to address this burgeoning challenge. And that's what brings me to today's guest, who I'm excited to introduce to you. This is Gina Hoots. Gina is a registered respiratory therapist. She has her specialty credential in adult acute care. She's also a registered pulmonary function technologist, and she's also a certified asthma educator. She is presently the CEO and founder of Hootenanny Joy, and we'll talk more about that in a minute. It is a wellness company for patients with chronic medical conditions located in Decatur, Illinois. Gina, welcome to RT Matters. We're so delighted to have you because of all the good work you're doing in the post-acute care space.
Thank you so much, Patrick. And I love your hat. RT definitely does matter. It's been a wonderful career for me. Thank you.
Well, it sure has. Well, we'll talk more about your current venture, but we also like to always have our invited guests kind of tell us if you found respiratory or respiratory found you, because we all seem to get into this profession vicariously. What was the first respiratory therapist you ever encountered? Can you recall that time?
I never did encounter a respiratory therapist before I chose the profession. I knew I wanted to be in the medical field. For some reason, I knew I didn't want to be a nurse. I don't know why. I did want to be a doctor, but, going to medical school at 18, that just wasn't kind of in my plans. But I went to that local community college where I found a red brochure in the advisor's office, and it talked about respiratory therapy. Now, I was on the waiting list of surgical tech. I'm so glad I didn't get into surgical tech because of my need to move around the hospital. And boy, respiratory was just the best choice. And so my first respiratory therapist interaction would have been to go to the hospital for my job shadowing experience. And boy, that just sealed it for me. I had a great team of mentors there.
Yeah, we're always pointing out to our listeners that you're being watched wherever you are. You're being watched by other respiratory therapists, by patients, by family. And sometimes that is the inclination for that person to become one of our members in the profession. So how we behave is very, very important. When did you get your first entry to practice? I think you graduated in 1991, if I'm not mistaken.
I graduated in 1991, and so back then the tests were on paper. So I was fortunate that my teacher had a capstone semester on pulmonary function that last semester of school. And back then, the CPFT was given before the CRT in order. So in June, we went ahead and just took that CPFT for fun, practice. And boy, I was able to pass that test when I did my other things. So that really laid the groundwork for pulmonary function testing.
Yeah, you started
registry
your career in pulmonary as a pulmonary function technologist, if I'm not mistaken.
No, I'm a general respiratory therapist. Love, night shift, all areas. ICU, ER, loved all of it. And then,
well, one of the things that I noticed is that you also, after several years practicing, you decided to continue your education and went back and actually obtained your master's in educational technology. What motivated you to do that?
Well, after I was a young respiratory therapist, I went ahead and got my bachelor's degree because I thought I might want to be a physician's assistant. And again, that didn't pan out, but I was able to start working into education. And so when I started being a clinical educator at the local community college, of course, if I wanted to become a full-time teacher, I needed that master's degree. And so that's where I started that. And really, my master's in education had been distance learning and instructional technologies. So really a great master's degree.
Yeah, we're always encouraging RTs to take advantage, especially the newer graduates. Once you get your registry, that's just like the first stepping stone. And as you pointed out, you looked about being a surgical technician and a nurse, and all of a sudden respiratory, it seems, found you, and you have a stunning career, over 30 years practice so far. Now, I noticed in addition... I'm sorry?
I'm never going to be an APRT, Patrick. I am just bummed about that because that would have been the best thing. But I'm here as an APRT cheerleader.
Yeah, I've heard that from several of our guests that always said the same thing. I wish I was 20 years younger because that APRT would have been my goal. But I also noticed, in addition to your NBRC credentials, you also obtained your certification in clinical sleep health and also a certification in healthcare compliance. What was your motivation? I'll call these peripheral certifications, but they certainly are related.
Well, tell you, I wasn't going to get any more credentials just because of the continuing competency. Silly, because I love to do continuing competency all of the time. I got my asthma educator credential because the NBRC had a freebie respiratory week promotion. So I got the practice test. So I took the practice test and got my asthma educator. Now, the other two, certified health coach, I had somebody in my organization as I was leaving leadership and trying to find a new way. She said, you'd be a great health coach. And I never thought about that. So I researched that one. And then the certification in clinical sleep health. I love sleep medicine. I wish I could just dive deep into sleep medicine. I have a daughter who's a registered sleep tech leader, and she wanted to get this CCSH. When I looked at it, it has every element of a respiratory therapy coaching session. It's all about interpreting the sleep study results to give the patient the best outcome. Yeah.
That's offered by the registered polysomnography. So you actually went down the more difficult road because the NBRC now has a sleep specialty exam, but you basically trumped that. Now,
those are two different exams. And so, but I did not get my RPSGT. So I'm not a sleep technologist that way. I'm just a clinical sleep educator. Now, a really cool thing is I got to spend some time with the RPSGT board and do some exam development with them. And that was just such a nice blend of old school polysom texts and new people like me who are using that credential in a very different way. So I lots of fun with it.
Now, in healthcare compliance, there's a big focus today on healthcare fraud and abuse, but also just minor coding and billing mistakes. Why get into healthcare compliance? Because I tell you, that's very important right now, I can tell you.
I don't do much with healthcare compliance, but yeah, I would strike that.
All right. You also are a certified health coach, as you mentioned. How has that impacted your patient education efforts that we'll get onto in a moment when we talk about Hootenanny Joy?
Well, I tell you, I'm a respiratory therapist. Respiratory therapists educate. That's the way I was taught way back in the day. I'm an original Terry Desjardins mentee. And all of the students around the country know that he's got a great textbook. But I learned how to do respiratory therapy the right way is what I like to say. My brand of respiratory therapy is to assess the patient talk to the patient, make sure they know what they're doing. I may spend 15 minutes not giving an albuterol treatment, but doing all of the other things that need to be.
Right. And again, that's that whole message about chronic care is so much different than this silo mentality of just treating the disease or the lung. Now, let's talk about Hootenanny Joy. Following 30 years of clinical practice, and as you mentioned, you basically were in all areas. You were an educator, you were an advisor, a clinical coordinator, an administrator, department director. But in 2023, you started Hootenanny Joy, which we mentioned is a wellness company. What motivated you to go ahead and take that step and become an entrepreneur?
Well, I knew from all of my years of respiratory therapy, there was nothing like this where we're actually doing wellness with our respiratory patients. I really thought I was just going to be a plain old COPD health coach out and offering my services to the masses. You see people on Facebook and such that have all kinds of questions. Every day in the PFT lab, people have questions and they don't know how to connect themselves. So I started by putting first of all, I started partnering with the health coach group. They have a team of health coaches that really kind of helped me see a broader part of respiratory therapy. And then on LinkedIn, I tried to find my friends. I was listening to a patient support group and I heard my friend Matt say, hey, I have a virtual pulmonary rehab, but I'm going to start using some health coaches. And hey, that was just the opposite of what I needed. I did not want to do virtual pulmonary rehab with my clients, but I knew I needed a partner. And so I got hooked up with Matt and another friend, Kelly. And we really started doing this health coaching planning over the years. And so Kelly already had a COPD curriculum on her website that never kicked off. We've really decided COPD patients don't have a lot of money, so they're not going to be really money makers for any of us, but we really felt strongly about giving them tools. And so we've really put together a pretty comprehensive offering with virtual pulmonary rehab with Blue Zone Needle. We've got health coaches, respiratory therapy doing the question and answer. And then we do a lot of free stuff. Now, Hootenanny Joy has evolved over the years. I, again, thought I was going to be a respiratory therapist health coach. That's not really where it's at now. And I was starting to feel like a fraud, to be going away from respiratory therapy because I'm such a respiratory therapy cheerleader. But the COPD Foundation Journal came out with an article a couple of years ago where they talked about looking at the diets of emphysema patients. And what it was is they had all of these patients that they looked at that had, let's say, the same smoking history. So they corrected for that. If you had a diet full of fruits and vegetables, your chances of getting emphysema was significantly lower than those with a very poor diet. I mean, it was dramatic.
Let me just say what you've done is you've incorporated that as well as other input into the mission and focus of Hootenanny Joy. And I'd like to do now is to focus down because some of those elements are absolutely important to what you're looking at today. Let's take a look at what you call your 4 key aspects. And I'm going to give people your web address at the end of this episode. But you have 4 key essentials of this transformative approach, which really is transformative. And the first one is you have this holistic approach. Now, briefly summarize for our listeners why the holistic approach. You've already alluded to it with the diet, but there's also other aspects included in the holistic approach.
Well, Hootenanny Joy is about finding small, sustainable ways to care for our bodies, brains, and emotions, especially when life is loud, busy, and demanding. We're blending science, storytelling, and community to help people slow down, regulate, and remember that joy doesn't have to be earned, it can be practiced. Now, this came out of my own burnout. I was a respiratory therapy director during COVID. And just that's my burnout story there. Everybody on this call kind of can relate to that. And so I knew I needed to take care of myself. Doctors were throwing different kind of medicines at me, anti-anxiety, depressants, whatever. But if you're not sleeping and you're not eating, no medicines are going to work. So that's where I had to take care of myself first. I learned how to sleep, learn how to. And then 2 years ago, my mom got dementia. And she passed away from dementia a few months ago. And that's a really big deal. She's not supposed to pass away. She was not a drinker, not a smoker. But she had a lot of lifestyle factors that might have led her to that inflammation. And I got a grandma who's going to be 100 in a couple of weeks. And so I've just seen both with my family and my patients lifestyle factors.
And yourself. And yourself.
On myself.
Right.
Lifestyle factors are really where it's at.
Yep.
We know that you can't do well with your COPD if you're going to continue to smoke.
Mm-hmm.
And those kinds of things, whether it's a donut or if it's a sleep or anything, that we have to incorporate all of that into our lives.
Now, your target audience is not just patients with respiratory conditions. Is that correct?
That's correct. It's really people like. And so I've got a health coaching group right now. And really, I think what I like to do is these friend groups. So I've got 3 ladies who work together that have 3 different really health problems, but they just want to learn how to get better. And so, people like me who just want to learn more and improve their health.
Well, tell us more about the wellness programs. You notice in your website, you talk about sleep and you mentioned nutrition, you mentioned energy. What are some of the other tools that you give in this environment to encourage your members to become more involved in their own health care, which is really what your focus is? Heal myself, heal my body. Right.
Absolutely. So go back to some of our basic respiratory therapy principles. Teach back is super important. Setting SMART goals are important. So those are things that our clients can do. Now, I can't just tell you to quit smoking. I can tell you hey, let's find some strategies that work well for you today. For example, cutting your cigarettes back little by little. Instead of 20 today, we'll do 18 next week and then 16 the week. Now, I've gone beyond smoking cessation here. And so my group we're doing right now is tired of being tired. And so there's different things that we're looking at. We're looking at food and sleep, exercise, but also stress control, breath work, using our resources, and just making sure that we're celebrating our own successes and not just go to the grindstone.
One of the resources I saw on your website was Recharge Your Day. What is Recharge Your Day?
So Recharge Your Day is which is a resource that I made. It is really supposed to be one of those enticement tools so I can get people to sign up for my newsletter list for my audience. But really, it's about, just what you need to do for your day. In the morning, you're going to wake up. You need to not touch your technology. You need to look outside at the morning sunlight. You need to make sure you get some good breakfast with some protein. And so those are just really the core things of your day. If you start with those sorts of things, your day is going to be much better.
You're certainly going well beyond just basic respiratory care. This is a holistic approach. And I think the evidence is unequivocal that that's the approach that needs to get patients engaged as part of the care team themselves. And that's really the difference between what I consider being compliant, which is I'll do it because my doctor's going to give me a yell if I don't, versus adherence. You do it because it makes you feel better and it's the right thing to do. And that's a much different approach.
When I started having chronically ill parents and grandparents, one of the big things was Lasix. They didn't want to take Lasix because it would interfere with their social life. They would time their Lasix or skip their Lasix based on if they had to go out to lunch with their friends or whatever. And that's not what we tell people. Yeah, you've got to do it this and this and this. But that doesn't always work in real lives. And so one of the things I really like to do is take, I had the best health coaching client, and this happened to a bronchiectasis patient, and we got her ready to go to the doctor the next day. There was no mucus moving. There was no anything. So what I did on that coaching call was we went through the bronchiectasis action plan, and I prepared her to ask questions at her doctor's appointment the next day so that she would be fully ready. When she came back from the plan, we were able to talk through what kinds of medicine she had, when to take them, what would work best in her lifestyle.
So it's really a physician extender, which is what the APRT is doing right now, which is what you wanted to do. And I would have been the same way, by the way, 20 years ago. No question about it.
So I'm trying to be an APRT without the thing, and I'm just going to help wherever I can make use.
Right.
And, you just need somebody to sit down and talk to people.
That's right. Let's fall down on your core services, further the core services. Let's begin this respiratory support. You already alluded to it, but let's be more specific. Your coaching, relaxation techniques, how to identify stress, pursed lip breathing, the use of the and information you're giving your patients before they see their physician, which I think is just absolutely a well-informed patient is a much better patient, and the physician of the nurse practitioner or the PA appreciate that interaction.
As a matter of fact, that patient went to her doctor and spent more time. The doctor spent more time oohing and ahhing over the bronchiectasis action plan than he had ever seen, more than taking care of the patient. So it was a two-way communication street. But boy, respiratory therapy, I'm a respiratory therapy cheerleader. Everybody that knows me, and mucus moving is my thing. Mm-hmm. And so if you're going to come to the PFT lab, you're going to spend, again, 40 minutes with me, up to an hour. And so in between rest times, we can identify those kinds of problems. And so not everybody needs extra albuterol. Not everybody needs their oxygen turned up. Those are the gaps that we can fill as respiratory therapists. Mm-hmm. I kind of have a standing order with my physician. If somebody needs a flutter valve, he's in a generic sense, I'm going to give one. And the doctor, trust my judgment that they indicate. Again, that's a pretty low, thing for me to do, but that's, respiratory therapy protocols. Relaxation tips and breath work. Until my burnout, which was, January 6th of 2022, that was the end date. I had never heard of breath work before. Thought, all these years, why haven't we been taught breath work? We've taught pursed lip breathing, which is very effective. Mm-hmm. But we these little things like box breathing, where you breathe in and out, those things can really help connect your breath with your nervous system, which is where a lot of our patients live. If they're going to be nervous, they can't really effectively get all of the reasons.
One of the things that I really like that I agree with, and I guess instinctively it was always part of my approach to patient education, was small step methodology. In other words, don't overwhelm them all at once. And I think good-intentioned acute care therapists, patients going home in an hour, we try and give them so much information, and all they want to do is just get in that wheelchair and get down to their car. And the problem is the system in the acute care doesn't give us the time to take care of that patient. And I'm with you. I think albuterol treatments could be replaced with patient education assessment. And the patient's going to be there for 2 or 3 days. And instead of giving an albuterol treatment every 4 hours, what they call albuterol till out the door, go in and spend time with the patient and do an assessment on their learning level, the language they understand, the words they don't understand, and make them more engaged.
I was fortunate after I left my teaching job, I transitioned to a COPD coordinator and really built a COPD readmission program. That was back then at 2000.
Right, I saw that.
And that was going. And boy, that taught us a lot. We can't fix the world. We can fix down to about 18%. That 18% readmission rate all has to do with social determinants of care. Mm-hmm. Social determinants of care, again, nobody wants to pay for proactively taking care of somebody. But an hour with me is a whole lot cheaper than an hour in the emergency room.
It's really nice.
It prevents a lot of those problems.
It's nice to see that one of the things that you had, and I'll let you know how I appreciate this, is that when the readmission penalties came out, some hospitals just basically said, well, just don't keep them as long. And you recognize that readmission starts with pre-discharge planning so the patient knows what their expectation is for the next 2 to 3 weeks while they're still recovering from the exacerbation at home. And that's the most critical time of the first 2 weeks following the patient leaving the hospital. And you get, like you said, I think you got it down very well. That was one of your jobs that I saw in your resume that you really took on to, was COPD discharge planning.
You just know what's right and what's wrong and where you can make plans. And right now we are a society that pays to take care of health, sickness. We haven't started taking care of wellness yet. And if we could put our money in better places, I think we could really make a big
well, I think the system is going to eventually get there. I'd just like to be able to work with people like yourself to kind of push it along, and to have some of our respiratory therapists be able to go out and take a risk like you did when you started Hootenanny Joy. And that was, again, that's the entrepreneur in you, that, there are needs out there. There are gaps. Let's go ahead and try and address those gaps and see if we can't make a difference.
And part of that, part of what I'm doing here is as much to feed my brain as anything. I am ADHD and crazy and go down all kinds of rabbit holes and learnings, and I want to learn about everything. And this is kind of a way for me to focus on myself on this. I have a blog where I can write an article about anything I feel like. I just kind of be creative there. We haven't talked yet about one of the best things that came out of this is the Cozy Lung Lounge, one of my projects with Matt and Kelly and an exercise physiologist, Amy, that I work with, is we can just sit down and we talk about these things all the time. And not only do I have a team to fulfill me professionally, but we're also preparing something excellent for patients. And so having that professional network is super important.
Oh, well, let me go ahead and finish this innovative conversation, informative conversation with the last few points. Are Hootenanny Joy programs available in person, online, or both? How does that work in terms of access to your resources?
It's really mostly online. So my programs are just on demand delivered. So if you sign up for a program such as the Sleep, it's a deep dive 12 weeks into that. And it's going to fill lesson each week to my client's email. And so they can be at any point in their progress. And they get those regularly recurring in their email box. Okay, now the big question is you're not obviously limited by physical geography because of your online internet access. So can our listeners refer patients to hootenannyjoy.com? If they're like you're in Decatur, Illinois, if I'm in Houston, Texas, and I have a patient who really needs what you have, I can just refer them to that website and then you'll work with them in that regard. Absolutely. I just got some chronic care flyers typed up for my physician partners. I work with neurologists, I work with cardiology, and I'm going to ask them to start referring patients to me as well. Now, I'm not licensed in any state other than Illinois. I'm a health coach. I'm not doing any respiratory therapy. I'm not doing anything other than education and discuss plan of care with them. So it's really not a licensure thing. You do need to watch for that. I'm not a dietitian, so I'm not giving any dietary advice. I'm not prescribing, food plans, that sort of thing. Mm-hmm. But I can equip the patient with what they need to manage their own health. Now, what if some of our listeners want to contact you and talk about trying to replicate what you're doing on some type of a small scale in their community? They can contact you with hootenannyjoy.com. Yep, absolutely. Contact me anytime there. You can find me on LinkedIn. But there's a lot of amazing work going on in this area, and I'm looking forward to expanding opportunities for respiratory therapists and patients. I went on your website several times to prepare for this interview. I noticed you also provide continuing education programs for licensing renewal. Well, so if you know me personally, I always talk about my side hustles. And again, that's just a way to get me. I'm always busy and I always want to do more and more. One of the things that I do, I'm of course an AARC, an Illinois Society member. And so local conferences are really great. And so I try to promote local conferences. I'm going to speak at one on this very topic February 26th. But I also like to do I partnered with a company called GatherEd, and they have a really interesting hybrid approach to learning. And I've got two right now. One's about vaccines and one's about liver antitrips, alpha-1 antitrypsin liver things. But what it is, it's a small group where we come together, we do some learning online, but then talk very briefly about how that impacts clinical. Mm-hmm. And it's just a really fun way to bring a lot of disciplines together. I think you're also either current or past president of the Illinois Society. So you also have a hat in the voluntary section of both the AARC and the Illinois State Society. I am Illinois Society president right now. Oh, and congratulations. I'm thrilled and having a great time with it. If you need some point, the respiratory therapists out there need to connect with your professional society. I am sure you can all moan and be grown and let you in one of those nice hospitals. Most of your colleagues are not going to be at the level of you. If you're listening to this podcast, you're already a high performer. And so you probably aren't around a lot of high performers, but they're all in that state society. And so having people around you can really boost your career, not only with networking, but just giving you all kinds of great ideas. I couldn't say it better.
Couldn't say it better, Gina. Thanks so much for your time today. And that brings us to the end of another episode of RT Matters. And we're going to thank Gina Hoots, our guest, for a very insightful and transformative conversation about the unmet need in post-acute respiratory care. And remember, as I said earlier, we want to hear from you, our listeners. Let us know what you liked about this. If you wanted additional information, let us know. We'll get it to you. And you can reach Gina at hootenannyjoy.com, and she'll be more than happy to share. She's very giving and forgiving, I should point out. Now, in the meantime, go out and be the best possible respiratory therapist you can be, because you and our patients deserve nothing less. You're a highly trained, licensed healthcare professional, and our patients decide and they need nothing less than that. So until the next time, be kind to yourself and to others, and remember, RTs do indeed matter. So be safe, take care, and we look forward to having you back in the next future.